Assalamu alaikum dear doctors, welcome question solving session. The question asking us which of the following represents her greatest risk in adult life. They give 5 options: A. Gallstones, B. Hemochromatosis, C. Lymphoma, D. Meningococcal septicemia and E. Pneumococcal septicemia. The question is, a 6-year-old girl has hereditary spherocytosis. Splenectomy has been advised. Her parents are particularly concerned about the risk of her health in adult life. So, the answer of the question is pneumococcal septicemia. I am explaining hereditary spherocytosis, then the answer will be clear. The incidence of hereditary spherocytosis is 1 in 5,000 people of Northern European extraction. It is inherited as an autosomal dominant with variable penetrance. So, from hereditary spherocytosis, this question can be asked: what type of disorder? That is autosomal dominant disorder. It usually presents in childhood with the classic triad: anemia, jaundice and splenomegaly. Remember, the triad is very important. Triad of hereditary spherocytosis is anemia, jaundice and splenomegaly. The jaundice is unconjugated and worsened with viral infections. Pigmented gallstones are present in 85% by the second decade. Neonatal jaundice is common. Aplastic crisis can occur. The diagnosis is made on clinical grounds by observing the spheroidal cells on a blood film and by the increased osmotic fragility of red cell when tested. In examination, this question also asks what type of cell present in blood film. The answer is spheroidal cells and osmotic fragility test. Treatment is symptomatic or by splenectomy, usually done laparoscopically. The spleen is the site of red cell destruction. Removal of the spleen will reduce hemolysis and the incidence of gallstones occur. There is, however, an increased risk of pneumococcal and other infections with splenectomy, and therefore it should be ensured that the patient has had pneumococcal immunization as part of the routine schedule and receive lifelong prophylactic penicillin. So, pneumococcal septicemia in adult life is a greater risk of life and her health. We know that gallstone also develop, but not gallstone is a risk of his health or life. The serious concerned condition is pneumococcal septicemia. For pneumococcal septicemia, the patient should need to take prophylactic lifelong. So, these are the questions come from hereditary spherocytosis. Please do subscribe and share my channel. Thank you everyone.